Hello, everyone. I'm Arya, your host, and welcome to today's FB Live session. Well, if you are Indian origin living in US and your parents are visiting from India, you do not need to worry about their medical needs in US. eGlobalDoctors has your back. They have different packages for you starting from just $199, providing access to 300 plus doctors from US and India with 30 plus specialties. Prescription will be provided after consultation and they get back to you within 1 to 3 days of time. Family members can also participate live via video physician consultation from any part of the world. This video consultation is about 30 minutes, and they have also newly introduced a very affordable nutrition and health section for diet consultation, which gives you the chance to talk to the expert nutritional coach. We'll tell a bit more about this in this live right here, so stay with us and visit www.eglobaldoctors.com to register yourself. So in today's FB Live session, we'll be exploring and providing more information about a very concerning topic, especially for women, that is the acne problems. So for this topic, we have our eGlobalDoctors expert dermatologist, Dr. Lata Rijhwani. She has done her MBBS from Udaipur, postgraduate from UK, and she also practiced dermatology in Kuwait. Recently, she's residing and practicing in Jaipur. Welcome to the FB Live, Dr. Lata. A very good morning to you. How are you today?
Yeah, I'm good. Good morning, and thank you for having me, Arya.
Nice to have you back. So this is a very hot topic for women. So I'll literally dive right into the very basic of this question. So what is acne, and is it a disease or is it an infection, and how does it look like?
Yeah, as you said, acne is very common, and in fact, for us dermatologists, it's takes a major part of our outpatient consultations. And acne, I would not say it is an infection, but rather it is a disease, and it's a multifactorial disease. And it actually occurs because of the increased oil secretion, which starts around puberty and which we call sebum. So basically it starts with increased sebum production, and then the pores on your skin, they get blocked, and there is inflammation, there is collection of oil, dead skin, and so it appears in different forms, like if you have mild acne, it might appear just as blackheads or whiteheads. Then if you have more like the moderate forms, you can see red bumps, the painful red bumps, you can have white bumps filled with pus. And then if we talk about still more severe, then you can get painful nodules on your face or chest or back, and you can have cysts. So we call it a nodulocystic acne. So it all varies on which type of acne do you have, and at which stage of acne have you come to us.
Okay. So can we concur that it happens mostly for the like people who have oily skin?
Yeah, actually around puberty, because of the hormonal changes and the male hormones, which we call androgens, they stimulate or trigger the oil glands, which are already present, and they increase the oil secretion. And it is then that you get it around 13, 14 years of age. And then, of course, it depends on your skin type, that how prone you are to get it. And of course, then we have adult acne, and I'm sure we are going to talk about it later, but mostly it starts around puberty, and it is seen on face most commonly. 60 to 70% of acne occurs on face, and we can see it on back, and then in slightly less percentage, we can see it on chest and shoulders as well.
Okay, right. So it's not a typical disease. So then what exactly causes these acne? Is there a role of like genetics or a family history to that?
When you talk about the causes of acne, genetics has to play an important role, because it is then if you can very commonly see that children whose parents used to get acne when they were teenagers, most likely they will have the same history. It is because that genetics decides your skin type, your oil glands and their distribution. So genetics has to play a lot. And then apart from that, stress is a very important part that can lead to emotional stress, physical stress, and Nowadays we can talk about the hormonal changes, of course, that occur like before menstruation in girls, and during puberty the hormones, the play of hormones plays a very important role. Then the dietary factors are very important these days. The teenagers need to focus on balanced diet and stop eating those junk foods and all, because all those foods that have high glycemic index, they raise your sugar level and they trigger the insulin secretion, and insulin in turn, it stimulates the oil glands, and this is how you get you are more prone to acne. Then in females, I talk about overuse of cosmetics, applying plenty of things on face, improper cosmetics which are not designed for your skin type. And in males, going to gyms, if you are taking those high protein supplements, the shakes, and sometimes even for bodybuilding, the use of steroids is a very important. It is a common culprit. And apart from that, there are certain medical conditions that can lead to acne, like in ladies, females. If you talk about polycystic ovarian disease, it's a very important cause of acne. It presents as acne. And then there are some diseases in which your doctors can prescribe you steroids, and the consumption of steroids leads to acne. And then there are some medications given for another diseases that can also lead to acne. So we have to evaluate the patient completely, that is it just like you are a teenager now, okay, it's happening, it will go away, or there's really a cause that we should address. Yeah.
Okay. So my mom used to say that all the time, that she had acne, so I'm having it. So I didn't know if it's real or she's just saying that to comfort me.
No, that is true.
Okay,
yeah.
That plays a role.
Yeah.
Okay, right. So are there any other medical conditions associated with acne?
Yeah, as I told you, that especially females, when they present with adult acne, like you have, across the age, like 25, 30, you had, still you are getting those bumps, especially around your jawline. So, and along with another features, like you can have excessive facial hair, you can have very thin hair on your scalp. And so or you can be obese, and especially the females who tend to gain weight or who have a family history of diabetes, we need to rule out a condition known as polycystic ovarian disease, in which the patient usually gives a history of irregular periods, or if they are married, they will complain of infertility. And so this is an important cause that they come to us mainly because of acne, but then they have this background condition. And then, as I said, you may be suffering from any other disease which needs the prescription of oral steroids, and then you can, have a really bad acne. So this is it. Yeah.
Okay. Great. So let me tell our viewers and listeners that we are live on Facebook and Instagram as well. So log into your favorite social media and ask your questions in the comments, and we will make sure to answer them right here in this live. Coming to the next question, Dr. Lata, this is a very common one. Like, what are the basic triggers or aggravating factors of this acne?
Yeah, this is very important. See, when a patient comes to us, of course, we tell them that you have to take medication, but then we have to address the triggers, and we have to educate them that, of course, you cannot do much about your genetics and your skin type, but then you have to know the triggers and that what you can do on your part to avoid it. So as I said, stress these days, the teenagers or even adults, there's a lot of stress, emotional and mental, and people are really, so just don't stress out. And some teenagers especially, they are so stressed out about their acne itself. Like when they have acne, they are psychologically disturbed and they feel low, and sometimes they are bullied. So just take the stress out and maintain a healthy lifestyle. Just join a sport, or you can walk or exercise, because exercising improves your circulation, and then, it flushes out the toxins, and it gives you a general sense of well-being. And then the diet, it's very important, and it has a role, like there are some studies that really have proven that if you consume the foods like pasta, pizza, burgers, and you are and taking a lot of sugar and those fizzy drinks, so it raises your blood sugar instantly. and then the vicious cycle of having those, it starts. So avoid those kind of foods if you have acne, and the chocolates and all sort of sugary things. Then overuse of cosmetics, as I said, use of makeup, using makeup all the time. And if you are using makeup, make sure that it is suitable to your skin type. Like if you have oily skin and on the top of it you are, using a lot of makeup, a lot of stuff on your face, so that can also trigger the acne. And of course, the hormonal imbalances are very important. You have to know your what is your how are your periods like. If you have irregular periods and other symptoms, you have to rule out PCOD, as I said earlier. And we can also make a hormonal test to rule out if you have any, hormonal imbalances. So as females, most of the times they complain that premenstrually, suddenly they get a lot of bumps on the face. So hormones do play an important role. And your diet, your exercise, and your proper cleansing routine, you have to follow a good skincare routine, choose the right products, use them in a right way. And don't just think that you will outgrow acne and you just ignore it. And yes, very important, do not pick and pop your pimples. This is a very important trigger. Like you get one and you tend to squeeze that or pop it out. That's not a solution. I mean, if at all you have a lot of blackheads, whiteheads, I would suggest that you approach a dermatologist and get it done in a right way. But do not try doing it yourself and worsen it. So these could be the triggers. So no touching at all. Yeah.
Yeah, correct. And I wanted to ask, like in this COVID period, we had this mask thing on. And even now I can see at the airports or big hotels or everyone is taking their own precautions, wearing masks. So does that mask thing contribute to occurrence of acne anytime?
Yeah, Arya, a very relevant question you have put up. And last year, surprisingly, when when the corona was at its peak, and most of the people were wearing masks for especially the people who are working outside in hot and humid climates, and they are wearing masks. So a lot of people, they used to come with acne, especially on this, butterfly area of the face, on the nose and on the cheeks. And so, in fact, a new term had come up then called maskne, which was occurring only because of masks. So what happens is that when you wear masks for a long time and you're sweating inside and you're not able to clean your face, or sometimes you're wearing, not clean masks, you're just wearing the same mask if you are wearing a cloth mask. So it had played a very important role. And then now also there are some people who for them it is mandatory to wear the mask. So I would suggest that if your skin is prone to breakout, so wear some breathable cotton masks under your synthetic masks, and make sure that you change them, you wash them properly, and wear clean and ironed masks. And of course, don't neglect that area, and put your medications on time.
Great, thank you. So I would like to add to that and ask you, what other precautions can we take to completely avoid these acne?
Yeah. See, apart from the treatment, I would suggest that when you go to a doctor, don't delay your, it will go on itself, or you can try something at home. I will always say that the thing is that once you come to us, eventually the acne is going to go away. But it is important to, approach a professional to prevent scarring. That's important, and pigmentation. So these are the two things that are really bothersome, and they are going to take time to heal. So first and foremost, when you get acne, go to a professional, take proper advice, and then start your medication or whatever. And then the precautions, as I told you, follow a good skincare routine, choose a non-comedogenic face wash for your face, like according to your skin type. And again, I would say your dermatologist will be the best person to advise a good face wash for you. And if your skin is dry or anything, don't just put any cold cream or anything on your face, because again, it is going to aggravate the acne. Use a right moisturizer, which is specially designed for oily skin or acne prone skin. Again, before, if it is mandatory for you to put makeup at times, choose a non-comedogenic oil-free makeups. So choose the right products, eat a good diet, make it a habit that you have to include a lot of vitamin C, vitamin A, vitamin E, and good, things in your diet. You have to stay hydrated, to prevent breakouts. Because since your skin is already oily and on the top of it, you're feeding more oil to it, that doesn't make sense. So just maintain a healthy lifestyle and follow a good diet, and exercise regularly. And yes, there are some poses of yoga, like if you're suffering from PCOD, try to lose weight so that your PCOD is in control, your acne is going to be in control, because everything is interrelated. You just can't put creams and think that there will be a magic and my acne will be gone. No, as I said, it's a multifactorial, and it is a, you have to address the entire thing. So if you take these precautions and address your hormonal balance, get your tests done in time. And for males, as I said, that putting a lot of styling gels on hair can trigger the acne, taking too many protein supplements or, gym shakes and all. And if you have dandruff, then again, it could, it can trigger your acne. So make sure that your scalp is clean. And because both have the same pathology, there is excessive secretion of oil in the scalp, which again increases the acne. So you have to address all that to get a, complete result for your acne.
Okay, great. So I think we have a question on Instagram. Someone is asking, can I use makeup if I have acne?
Yeah, I think I said, yeah, it's not that you don't have to use makeup. Of course, some people, they are, when if they go out and if they have some bumps visible on skin, they like to, hide them, or otherwise also. But then choose the right product. Don't let it stay for long. As soon as you are done, you have to remove it with, micellar water or any proper makeup remover. And there are many good brands in the market that have labels called non-comedogenic oil-free makeups. You can use them so that they don't clog the pores and don't worsen your acne. And make sure that before you go to sleep, make it a rule that you don't wear your makeup on. So if you take these precautions, and I'm sure that it won't worsen your acne.
Great. So hope you got your answer. And when we are at the topic of precautions, I would like to ask about how is the acne treated?
Yes, as I said, that the earlier you come to us, the better will be the result, and it will be, we can prevent it from worsening. So some people think that eventually you will grow out of it. When you grow older, it will go, but then it is going to leave marks, it is going to leave scars, and which will bother you, and then it will, it will take much more time. So if you have mild acne, for example, you have just whiteheads or blackheads, or even small tiny bumps on your face, mild acne can be treated easily with only topical medications. That is, you can give some creams which are mainly antibiotic creams. We have some benzoyl peroxide preparations, and we have some topical retinoids that work very well for your blackheads, whiteheads. So at this stage, if you start your treatment, maybe you won't go to that severity that I told you further. But if a patient comes who has moderate acne, like you have a lot of yellow bumps, pustules, pus is formed, if they are painful, then we can of course give oral antibiotics as well, because then the creams itself are not going to work. Of course, we'll give creams and oral antibiotics both. Then there are other severe forms of acne, nodulocystic forms, in which we have to go further. We have to give much more aggressive treatment in the form of oral retinoids. And then in some females, if they're not responding to any of them, you have to, rule out the hormonal causes. Then there are some anti-androgen drugs which can be given for hormonal acne, like spironolactone and things like that. Sometimes oral contraceptive pills are prescribed to address the hormonal acne. So this way, depending on what type of acne you have and what could be the possible cause, there are different treatments available, and they're very effective treatments available. But then you have to take them patiently for minimum 3 months. 3 to 6 months is the time period we recommend for complete, cure.
Correct. Right.
Yeah.
So can I also treat these acne at home? Like, do home remedies work? Like, we have a lot of videos on the YouTube also that people watch about these home remedies to treat acne, and it will go away in like 24 hours or like some period of time. So do that really work?
See, there's no magic, Arya, as I told. In spite of such advancement and so many good treatments available with us, I always tell my patients there's no magic. It's going to take time. And I myself, I'm not very fond of home remedies, Arya. I know that. A lot of things are being recommended because we as doctors, we always see the side effects of those remedies. Like when the patient comes to you, he or she always comes with Worsen. Oh, I had applied aloe vera gel and this happened before. So I am, frankly speaking, I will not recommend any home remedy. Previously, in our, grandmom's time, there used to be some clay applications, or which we call multani mitti and all. And I think that now I understand that basically it must be there to reduce the oil secretion or probably tighten the skin a bit, because then there were no good products available. And but otherwise, apart from that, I would suggest that if you have anything on your face, do not try any home remedy and just come to a dermatologist, or better leave it like that. I think that will be rather better, not to do anything.
Absolutely.
Yeah.
So then a common understanding among the youth is that health and fitness plays a very key role in preventing these acne. So can the diet trigger or maybe worsen the acne in any case?
Diet, Arya, has a very important role. Like when my patient comes, I take a lot of time to counsel them regarding their diet, and sometimes the patient also gives you a history that I'm back from a wedding, or I ate chocolates these few days and something has popped up. So doctor, do you think it is related, or is it just my? No, it is related, because it is science, and there are studies that prove that. Even there are some controversial studies about the dairy products, like especially milk, cheese, and other products, because of a lot of use of hormones in the source where they are coming from these days. So even those dairy products have been known to cause increase in acne. So we always tell them that high glycemic index foods, as much as possible, you have to avoid. And yes, they do trigger the acne. The high sugar content has to be avoided. Yeah. And even the dairy, if possible, like milk and all. I mean, you can restrict it, not too much. You can have curd instead, and a lot of good stuff. Yeah.
Great. So while we are on the topic of proper nutrition, let me tell our viewers and listeners about the new diet consultation. So we have different categories like diabetes remission, detox program, weight loss, child nutrition, gut health, menopause support, and many more, where we help people understand the root cause of root cause of the problem and provide suitable and healthy solutions as per your requirement and lifestyle habits. So register yourself today to get a personalized nutrition coach for you. So, Dr. Lata, I've heard from a lot of people that the forehead acne are caused due to dandruff. So, is it true? Like, can dandruff cause acne?
See, as I said, the pathophysiology is the same. Like dandruff is again due to increased oil secretion in your scalp. And so because the fungus that is normally residing in your scalp inactive, so when it gets food, a lot of sebum is secreted, it proliferates and it leads to dandruff. And similar kind of thing happens in acne, where the bacteria, which is already, residing on our skin, it proliferates because of the conditions that happen. So it is not that dandruff, when some people say, oh, dandruff falling on the forehead, it leads to acne. It's not like that. But yes, in 80 to 90% of patients who have acne, in my experience, when you inquire about the dandruff, they have chronic dandruff. Always, they will never have healthy scalp, because the pathophysiology is same. But it's not that the dandruff that falls on your forehead cause. But yes, we advise them to, not to keep a big haircut, like for boys, especially if they are putting a lot of oil on hair, and then when it falls on your forehead, it can increase acne. But it is not because of dandruff, it is because of the products they are using on the. But both are interrelated. You need to treat both for best results.
Okay.
Yeah.
So while we talked about the products, like choosing the right product is really important. And the most common product that people use is the moisturizer or the sunscreen. So how should someone know to choose the right sunscreen if they have acne?
Yeah. See, people these days, they are Googling stuff and they are using a lot of sunscreens without knowing that what is the type of sunscreen and what is suitable to their skin. So first you have to know your skin type, and then you have to know your concern. And then you have to know whether you really need a sunscreen. It's not like if you are, I would always in my practice, if somebody has a lot of things on face, like you have a lot of acne, inflammation, you have marks, so if not, I will minimize the products they are using on their face. Like I will just say that minimum cleansing is required, and then if your skin feel dry, you have to use a good moisturizer. But yes, if you are going out in sun, your job is like that, you're working outdoors, you really need a good sun protection, then you have to choose gel based sunscreens, because again the sunscreens have the labels. They have the label of oil free sunscreens, water based, gel based. They are more lighter, they are in lotion forms. And nowadays we have very good moisturizers with sunscreens. Like mostly the people who are on acne medication, they can feel a little bit dryness in some parts of their face in the morning. So they can use a moisturizer which is lightweight, and then it has a sunscreen. So that will be a good way to, to avoid so many products, and then you will get the benefits of both. Don't just buy any sunscreen. And again, I would say always go to a professional to be guided properly.
Absolutely.
Can worsen your acne actually. A thick sunscreen, if put just like that, it can worsen the acne. Oh. And sometimes it's not required. People are just putting for the sake of putting. Okay, I have to cleanse, and then I have to tone, and then I have to moisturize. And so then don't just go by this. Everybody is different, Yeah.
Correct. So we do hear about these acne problems a lot in the teenagers, but is that any different from the adult acne?
Yeah, in fact, we get many patients who have, who are 30 or 35, and still they say that we never used to have acne when we were teenagers. Our skin was clear, and now this is not the age to get acne, but then they come with acne. And here, the most important cause is the hormonal issue. Most of the times we find underlying hormones, and sometimes, especially in our part of in India, the use of topical steroids, like over the counter, you can buy any medication easily. So the females of this age, especially for pigmentation issues or for fairness or for even tone, they are buying over the counter steroids, and then they present with those bumps, and even they are not aware that it can be the side effect of the creams that they were applying. So first you have to address the hormonal issue. Second, just make a good history about what was their application. Sometimes for years they were applying something on their face, and mostly the adult acne will be differentiated that mostly you will get the papules or pustules in the jawline. It is mostly coming near the jawline rather than on forehead and in the T-zone. And you always have the underlying cause which is there, either some application or some medication they are taking. So take a proper history and then treat accordingly.
Right. So coming to a last question, now that we have learned so much about the adolescent and the adult acne, so what are other skin infections or conditions that are very similar looking to the acne?
Yeah, this is a very relevant question, Arya, because there are some infections which look exactly like acne. Like it's very important to diagnose, whether it is acne or there's some other kind of skin infection. So most common what we see on face is folliculitis. Like there is infection of the hair follicle, that the place from where your hair originates, you get tiny red or white or pus-filled bumps over there. And in females, it is very common because especially after waxing or threading, like when the hair removal is done, especially here on the jawline, and they suddenly get those bumps, and which is not acne, and it is short-lived, and with proper treatment it goes away. And even after threading around the eyebrows, you can get it. So folliculitis is one which common. Then again in adult females, like after 35, 40, rosacea is very common and commonly misdiagnosed. Sometimes people are taking treatment for acne for a long time without any response. And actually it is not acne, it is rosacea. So in rosacea is treated in a completely different way, has different triggers, and so only your dermatologist will be able to diagnose the thing in a correct way. So don't just apply anything like that. There are many conditions that can mimic acne, especially folliculitis and rosacea. It's very important to rule them out.
Wow. So with that, it's a wrap. Thank you very much, Dr. Lata, for taking time from your busy schedule and contributing to a valuable session on acne problems and solutions to it. It was
You're
very
welcome.
informative. I personally learned a lot of new things, and I'm sure it must have cleared so many questions for everyone watching this live.
Yeah, thank you, Arya. It was nice, and you had put very nice and to the point questions, and I enjoyed answering them. I hope they were useful to you and the audience as well.
Absolutely.
For having
So
me. Yeah.
thank you very much. Hope to see you soon with another interesting topic for our live. Till then, take care and have a wonderful day ahead.
Yeah, same to you. Thank you so much.
Thank you.